Over 1,500 measles cases have been reported in the United States this year, the highest number since the disease was declared eliminated here a quarter-century ago. 3 children have already died, and hundreds more have been hospitalized. So how did we get here? And could measles be making a permanent comeback? Stick with us as we unpack the numbers, the risks, and the politics fueling this crisis. And don't forget, hit like and subscribe so you never miss critical updates on health and science news. As of September 30th, the CDC has confirmed 1,544 cases of measles across the U.S., 92% of them in people who were unvaccinated or whose vaccination status is unknown. That makes 2025 the worst measles year since 1992. This week, Minnesota reported 10 new cases, bringing its total to 17. Some were linked to earlier infections, but others came from international travelers. Proof that measles can slip back into the country at any moment. California and Illinois also confirmed fresh cases, though smaller in scale. The largest outbreaks this year have been in Texas and New Mexico. Texas reported a staggering 762 cases before declaring its outbreak over in August. New Mexico had 100 cases, the second largest in the nation, before shutting down its outbreak last week. And while those outbreaks are now under control, the damage was devastating. Around 200 children hospitalized, and 3 lives lost. It's the first time in a decade measles has killed children in the US. Here's the tough truth. Measles is entirely preventable. The MMR vaccine, measles, mumps, rubella, is safe, effective, and widely available. But herd immunity requires 95% coverage, and right now, only a handful of states hit that benchmark. Even states with decent averages have vulnerable communities with much lower vaccination rates. In Texas, for example, the overall vaccination rate is just below 95%. But some counties fall far below that, creating perfect conditions for outbreaks. Making matters worse, political leaders are undermining public health. Health Secretary Robert F. Kennedy Jr. and President Donald Trump have both promoted the debunked myth that vaccines cause autism, claims long discredited by science. Trump even floated splitting the MMR vaccine into separate shots, a move that experts warn would tank vaccination rates even further. Some may think of measles as an old, harmless childhood illness, but the reality is deadly. Measles is one of the most contagious viruses on Earth, spreading through the air hours after an infected person leaves a room. And beyond the rash and fever, it can trigger pneumonia, encephalitis, and long-term complications. It can even cause immune amnesia, wiping out your body's memory of past infections, leaving you vulnerable to other diseases for years afterward. The good news? Outbreaks can be stopped. Vaccination remains the strongest defense, and in places where health officials acted quickly, like New Mexico, the virus was contained. But experts warn that unless vaccination rates climb, measles could permanently reestablish itself in the U.S., undoing decades of progress. The U.S. eliminated measles once. We can do it again. But only if vaccination rates go up and misinformation goes down. The science is clear. Vaccines save lives. What do you think? Are low vaccination rates the biggest health threat America faces today? Let us know in the comments. If you found this breakdown helpful, hit like so more people see it, and subscribe for updates on public health and science stories that matter.